Live from Chevy Chase.
Hey guys, welcome back. It's time for our morning chat, and today we're bringing heart health to life in a way that's easy to understand and inspiring for everyone. It's a staggering statistic, but approximately every 40 seconds, someone in the United States is going to have a heart attack. And here in Kentucky, heart disease is the leading cause of death, especially in women. But there are things we can do to improve our heart health. And here to break it down is five-time board-certified cardiologist, Dr. Yaz Daaboul. Welcome to the show.
Tam, Lee, thank you so much for having me.
Thanks for being here. Yeah, so you talk about heart health. You're obviously a cardiologist there at the Harrison Memorial Hospital in Cynthiana. Tell us, what are 5 easy things that we can do, and maybe they're not so easy, to help live a more heart-healthy lifestyle?
Yeah, no, that's an excellent question. So, you know, heart health really starts with the daily habits. It starts somewhere in the kitchen. It starts, at home. It does not start at the doctor's office. Yeah. So 5 things, 5 habits that we always tell patients include things like eating healthy, which sounds obvious but is not as easy to attain.
Yes, I know.
Yeah. Number 2 is exercising. That, we always recommend it, although I know it's not always accessible to everybody, but it doesn't have to be, an expensive gym membership. It can be something as easy as making little walks every single day, or, taking the stairs every day instead of an elevator. So just being active. Number 3 is follow up with your doctor regularly. Make sure you know your numbers, things like your blood pressure, things like your cholesterol, your sugar numbers. These are silent diseases that we don't know about for many, many years, and they can become eventually fatal. So knowing about these early on is really crucial for heart health. Number 4 are things, habits not to do, which include smoking cessation. We would never recommend smoking. It is one of the most deadliest habits that people can do, not just for the heart, but for other organs as well, including the lungs, including the bladder, a lot of other organs, cancers, and things like limiting alcohol intake. There are, recommendations according to the American Heart Association, according to the American College of Cardiology. It's not, 1 drink a day is okay, but drink in moderation. Don't be excessive about it. So these would be the 5 things to do to maintain a good heart healthy, balanced lifestyle.
Yeah, they make sense. And one of the things, just off air, you and I were having a conversation that there are also things in our daily lives that we have at our disposal that we may not even know could help us out. And that's our smartphone and our smartwatches. So you said there's some good apps out there that'll help us out?
Yes, smartwatches are obviously a big technology boost, especially now in healthcare. We're incorporating a lot of these smart technologies into healthcare. So they're becoming part of our daily, healthcare management, actually. And patients ask us every single day now, what does my Apple Watch tell me, or what any smartwatch tell me? So there's a lot of actually data related to smartwatches, and some of these are very reliable. So we know there are some data specifically to Apple Watches, because this is what was studied, related to the diagnostic ability of the watch, especially in detecting abnormal heart rhythms. For instance, we know that atrial fibrillation is very well detected on an Apple Watch at a very high sensitivity. And we also have learned, a lot of the information now we know about atrial fibrillation comes from watches, including the incidence of the disease in the population. Now we know that information based on Apple Watch, and people subscribing to these trials based on their Apple Watches. There is also a lot of hype around things that don't necessarily matter, so things that are not clinically relevant. You will see watches being sold for all sorts of reasons. These are still debatable. So not everything that is sold is obviously true, but a lot of them are, and I think they will inevitably become part of the future, so we have to embrace them, and we have to, I think, accept them, and I think they're very helpful.
Yeah, okay, that's interesting. Now, Thanksgiving is next week, and a lot of people just let it all hang out on Thanksgiving and eat a lot of food like me. But if you have heart conditions, what are some things you should watch out for?
Yeah, people with heart conditions should be cautious about how they eat and what they eat. And especially, we always warn people with congestive heart failure. These are people who retain fluid easily, and they can eventually end up in a hospital if they retain too much fluid. And usually fluid retention comes from salt intake. So Thanksgiving food is very salty, obviously, so we would recommend maintaining a moderate amount of salt intake, and watching, the amount of salt that they're eating, and obviously checking their blood pressures, because that could also raise the blood pressure. So if there's any concern for fluid retention, things like feeling winded, short of breath, swelling in their legs, these are early signs to definitely tell the doctor. because these are, manageable, and they can be fixable and reversible without, that person ending up in a hospital, especially after a Thanksgiving dinner.
Yeah, that'd be a terrible way to spend
what you're
Thanksgiving
talking
Day.
about. We're going to have you back at some point.
Thank
we
you
have
so
all
much.
of the information up on the screen. Thank you for being here, Doc.
Thank you.
All right, stay with us because we're talking with actress and author Tori Spelling of 90210 about a condition that has affected her and her daughter Stella for a long time. But she has some good news to share.
She sure does. Stay with us. Live from Chevy Chase will be right back.